Clinical examination of the alimentary system, the mouth. Now proceed to examine the mouth. Examination of the mouth allows the physician to assess the degree of dehydration from the state of the tongue and mucous membranes. Look out for specific lesions of the mouth like ulcers, sore patches, and lumps. Also search for local additional clues that may help in the diagnosis of systemic diseases. For example, in measles, a spotty enanthema in the oral cavity often precedes the rash. Ulcerations on the buccal mucosa about stensin ducts produce complex spots. In infectious mononucleosis, an acute pharyngitis and tonsillitis that may be coated with a gray-white exudate membrane may be present with enlargement of lymph nodes in the neck. Physical damage of the lips may produce painful fissuring with kaolin and crust formation. So the crust formation is called cheilitis. Cracks at the corners of the lips, called angular stomatitis or chelosis, are common. They may be due to anemia and malabsorptive states, and they can also be caused by overlapping of the lips in edentulous patients or those with ill-fitting dentures. Herpes simplex is a common infection that affects the lips, and this results in clusters of vesicles on the lips and surrounding skin. Localized chronic ulceration of the lips can be due to a carcinoma, which may appear as a thickened plaque or vertic growth. The lower lip is a common site for carcinoma, particularly in men. Pipe smoking is a predisposing factor. Anyone suspects carcinoma, you must not forget to feel for possibly enlarged submental nodes. Hereditary hemorrhagic telangiectasis are bluish spots on the lips, tongue, and buccal and nasal mucosa. So the endoscopists have identified similar lesions in the upper gastrointestinal tract as far as the stomach, and the great importance of these lesions is that they bleed intermittently and produce a chronic iron deficiency anemia. In Peutz Jeghers syndrome, as PEUTZ JEGHERS syndrome. There are bluish flakes of pigmentation at the mucocutaneous junction of the lips or around the mouth. Their importance is in their association with small intestinal polyps that may cause intestinal obstruction, intussusception, or undergo neoplastic change.